Yeah, I brought my phone.
Being on that it's 9 o'clock, we'll start the meeting with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, we have the agenda in front of us here today. Got quite a few things to go through. Everybody's had a chance to look at those. Is there any additions or corrections or questions? If not, is there a motion to approve?
I'll make a motion to approve.
Second.
Greg seconded it. Any further discussion? If not, all those in favor signify by saying aye. Aye. Opposed, same sign. Approval of the previous minutes from the February 4th board meeting. Everybody's looked at those. Is there any additions or corrections to those? If not, is there a motion to approve?
Make a motion to approve the board meeting minutes from February 4th.
Is there a second?
So move.
Motion been made and seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Work group session minutes from February 11th. Everybody's had a chance to look at those. Is there any additions or corrections? If not, is there a motion to approve those?
Make a motion.
Second. There's only three of us.
Second?
Has to be one of three of us.
Yeah, it was,
There's only three of
I
us.
wasn't here, so,
Right.
yeah.
Abstain.
No further discussion. All those in favor signify by saying aye.
Aye.
Opposed, same sign. All right.
Abstain.
Yep, I abstain too, yep. Okay, moving on to public comment. Is there anybody who would like to make a public comment? Okay. We could move right into appointments, I believe. Our first one is presentation regarding the proposed spongy moth treatments in Houston County during the summer of 2025. Someone from MDA here today? Welcome.
Thank you for having me. Excited to be here. Do we have the? Oh, yeah. It just takes a little while.
It's getting warm. It's cold today.
Yeah.
It warmed up.
Yeah, I think we're all running a little bit slower today. Well, I'd like to, while we wait, thank you all for the opportunity to allow me to speak today. And we're excited to be partnering with Houston County this upcoming summer for proposed treatments. And we'll get into all of what exactly we're looking at in just a sec.
Okay. So have you had success with these treatments in the
Yes,
past?
absolutely.
Yep.
Yeah, it's unfortunately with this pest and kind of our overall goals, it's really to slow the spread of spongy moth, not to stop the spread
Okay.
of spongy moth. So even though we're having like successes, it's still going to keep moving in.
Yeah.
Unfortunately.
Yep, yep. Kind of slow the spread.
Yeah.
Well, it says no signal. I'm doing a help ticket. I'm gonna try this one up here.
Okay.
See if that works. And if not, we might have to do it without the view. It is in, I think, I'm not sure if it's in your packet or not, actually.
No, but it was sent to all of them.
Okay.
Yeah.
So
it
you
was-
might have to
it was
follow along
another
on your
email, wasn't
computers.
it?
Okay. Can I just ask you a question right off the bat?
Yeah, go ahead.
Since
Yep.
I'm one of the recipients of your study. How long has that been done? The studies like with the, triangular?
Oh,
bird?
with the traps, yeah, we've been trapping and treating spongy moth in Minnesota since the 70s.
Oh, wow.
So
Okay.
quite some time. It's really over the past few years that we've sort of reached the critical mass of spongy moth entering Minnesota that we've seen a lot more traps and a lot more treatments.
So you have a lot of data.
Yes.
Oh, good.
Alrighty.
Filling in.
We'll just dive right into things. My name is Matt Gallo. I am the statewide spongy moth treatment coordinator at the Minnesota Department of Agriculture. Next slide, please. So we're going to start with a little bit of background on spongy moth, what exactly it is, and why exactly we are looking to slow its spread in the state. Next slide, please. So we have good news and bad news in our discussion here today. We're going to get started off first with the bad news. Next slide, please. So spongy moth is widely considered, formerly known as gypsy moth, by the way, one of the most destructive invasive species really unleashed anywhere in any part of the world. There's a ranking of the top 100 worst invasive species, and spongy moth finds itself nestled within that list. And as you can see, oh, if you don't mind just going back real quick. Thank you. As you can see from all of these articles here, no matter where spongy moth is found, no one really has any good things to say about it. You know, whether it's the raining down of its feces, whether it's defoliating trees, whether it's ruining our vacation destinations, it truly is the stuff that nightmares are made of. Next slide, please. And really, the problem with spongy moth is that it's a defoliator. So essentially, the caterpillars eat voraciously on many of our native tree species, and when we have widespread spongy moth outbreaks, we get scenes that look like this, right? Where you're looking at an aerial shot. This is probably in May or June. I don't know exactly when this photo was taken, but you can see all those brown trees have had their leaves completely wiped clean thanks to spongy moth. Next slide, please. Another scene here, this is a really big outbreak in Pennsylvania back in the 80s, and again, this photo was taken in June. And you can see all of those brown areas that stretch off, miles and miles into the horizon. Huge forested landscapes that have had their leaves chewed off by spongy moth. Next slide, please. Spongy moth is capable of feeding on over 300 different species of trees and shrub. And when we jump to the next slide here, we can see that of the tree species that it prefers to feed on the most, the trees that are most susceptible are things like aspens, basswoods, birches, and oaks. Other species are maybe a little bit more resistant and in some cases even immune. But when we jump to the next slide and we see the tree species that are most common in Minnesota, we see aspens and oaks and birches and basswoods. So Minnesota is unfortunately rather uniquely susceptible to spongy moth because we just so happen to have lots of tree species that are quite susceptible to spongy moth feeding. Next slide, please. Now, when we're looking at the impacts of spongy moth, besides just the defoliation that it causes, we see lots of different impacts across a wide variety of areas. So first of all, we're looking at health concerns. So spongy moth caterpillars are covered in long hairs, and for people with sensitive skin, if they do come into contact with it, it can cause rashes. It can cause just be a general nuisance and impact property values. So I used to work as an invasive species manager in upstate New York, where we've had spongy moth established for several decades at this point. And you can imagine the property value impacts when you have literally millions of these moths crawling all over your house, all over your yard, you're running over them in the road. Again, like the biblical raining of feces on your house, on your deck, and your lawn, it's going to be an impact. As well as the economic impacts of quarantines that need to be put in place to slow the spread of spongy moth when it comes to the timber industry. Next slide, please. That's kind of just the general impacts of spongy moth. I want to dive in real quick into what exactly spongy moth is here. Next slide. So spongy moth is an invasive moth species originally found across northern Africa, Europe, and Asia. It's known by the scientific name Lymantria dispar. First introduced to the United States in Boston in 1869, and we've been trapping and treating spongy moth here in Minnesota since the 70s and 80s. Each spongy moth caterpillar is capable of consuming up to 1 square foot of leaf cover per day. So you imagine a little caterpillar like that, that's a lot of leaf area. Next slide, please. So when we're looking at the spongy moth life cycle, really the most important stage that we are concerned about, and this is the only part of the spongy moth life cycle where they're actually feeding, and this is where all of the damage takes place. They do not eat at literally any other point in their life cycle, and that is the caterpillar stage. Now, depending on the local climate, when I'm going to be giving similar presentations like this up in St. Louis County next week. The exact dates of when those caterpillars, are going to be emerging are going to vary, but generally we're looking in the ballpark between May and June is when these guys are coming out. Throughout that time period, they're going to feed quite voraciously, and at some point over the middle of the summer, They're going to pupate. You remember back to kindergarten class and learning about, monarch butterfly life cycle. It's pretty much the same deal here. They're going to emerge as adults for about a week or two in the late summer. Now, the females are larger and white, and despite the fact that they have wings, they can't fly. The males fly to the females. Once they find each other, they mate. The female lays her eggs, and the moths just die. They exist purely to mate. And then the egg masses that a female lays, you can see in the picture in the top right over there. It has kind of a spongy texture to it. There's about anywhere between 500 to 1,000 eggs in a single egg mass. So just in that picture, we could be looking at as many as 2,000 eggs. Next slide, please. And the thing is that females are not very picky about where they are laying those eggs. So we often see eggs being laid on things like firewood, household equipment, nursery stock. Next slide. On tourist infrastructure, so RVs, industrial equipment, outdoor equipment. Next slide, please. Holiday greenery, industry, and just visitors from areas that already have spongy moth populations established. All of these are potential pathways for spongy moth to spread, which makes our jobs really hard because it means that we are constantly playing a game of whack-a-mole where new spongy moth populations are sprouting up because someone is moving them in somewhere. Next slide, please. So here is a map of North America of the established range of spongy moth. The dark blue areas are counties under quarantine. So those are places where really, I think for the easiest way to think about it is they just have established spongy moth populations that are at this point cannot be eradicated anymore. Now that green kind of band that circles around those darker blue areas, those are sort of our action areas. That's where the spongy moth invasion front is moving into. So we can see, it's pushing southwards into North Carolina, it's pushing into Indiana and Ohio, but really here in Minnesota, we are finally at the crest of the wave of the spongy moth invasion, so to speak, because they have really kind of ripped through Wisconsin at this point. Next slide, please.
So there was a darker green there too.
Whereabouts?
Next to the blue?
Next to the blue.
Yeah, that's what I was.
That's what you're referring to?
Yes, that's what I'm
Okay,
referring to. Yep.
okay.
So that whole kind of it stretches down the length of Minnesota and then kind of cuts at a right angle and then goes down into the Appalachians in North Carolina. That is the current infestation wave, where they are infesting previously uninfested
Okay,
counties.
and then the lighter green is where you're trying to manage.
Yes. Next slide, please. So despite all that being said, we actually do have a really strong framework in place when it comes to dealing with spongy moths. That's where the good news is. When it comes to a lot of other invasive species, we don't often have these sorts of tools in our toolbox to dealing with them. But with spongy moth, we actually do have a lot of ways that we can properly manage this pest. Next slide, please. And we could just jump to the next one. So we operate the MDA in partnership with several other departments of agriculture at the state level, as well as the U.S. Forest Service, operate under the National Slow the Spread program. This is a joint federal and state level partnership where we all coordinate together to slow spongy moth at the sort of national scale. We have consistently met and it exceeded the benchmarks we've set for ourselves. Our goal is to reduce the spread by around 60%, so just the amount of miles that spongy moth is moving each year into new areas. We've actually been able to hit as high as 80% in terms of how much we've been able to reduce that spread rate. Next slide, please. Now, when it comes to spongy moth, there are a couple diseases. I think just for the sake of time, I'm not going to spend too much time on this slide here, but when it comes to areas that are heavily infested by spongy moth, so those are kind of, those more East Coast, Northeastern states, your New Yorks, your Pennsylvanias, your Massachusetts, your Maines, spongy moth actually isn't the most threatening. It is still a big problem, but it's not the most threatening invasive species that we have there because there's both a fungal disease and a viral disease that work sort of together to keep the population of spongy moth in check. Now, the problem that we have is that spongy moth spreads faster than these diseases can keep up with. And so really the main crux of why we're trying to slow the spread, because if it's going to infest all of Minnesota anyways, and why even bother slowing it, right? The reason why we're trying to slow it is to give these diseases more time to catch up with the population, and then they can do the job of actually regulating the spongy moth population for us. Does that make sense, what I'm kind of connecting there? Mm-hmm. Great. Next slide, please. So when we're looking at the success of slow the spread, we can see it demonstrated right here in these maps really well. So we have a photo on the left, and those three lines represent the predicted spread of spongy moth without our slow the spread efforts. You can see as we go through each decade from 2025 to 35 to 45, spongy moth is jumping, hundreds of miles each decade, while the predicted spread of spongy moth with the map on the right over there, with our slow the spread efforts, you can see that that spread has really been reduced to a crawl, especially in certain parts of the country like Ohio and Indiana. Minnesota, we're not so lucky, but even still, you can see just how much we are able to limit the spread within Minnesota. Next slide, please. Now, when it comes to our spongy moth management techniques, this was brought up just before, we have a series of tens of thousands of traps that we use to trap spongy moths as they're moving into these new areas. And based on the amount of spongy moths we're catching within these traps, and there's about 20,000 or so set up across the entire state, we are able to determine the areas that are most impactful for us to do our management within. Next slide, please. So based on where we found our highest trap counts, we've identified sites across 9 counties, about 100,000 acres or so, mostly concentrated within the northern and southeastern corners of Minnesota because, as spongy moth is moving in from Wisconsin, that's just where they've set up shop first. Next slide, please. So when we're looking at Houston County specifically, and I apologize that it got a little cut off over here, but we have 3 separate sites. These are all mating disruption blocks. So we use 2 different ways at the MDA to manage spongy moth. That's with a bacterial disease called BTK and another technique called mating disruption. We are only going to be using the mating disruption technique in Houston County for this year at least. Next slide, please. And this is a closer up version of what specifically we're looking at. So these are our 3 sites that we've identified: Money Creek, Beaver Creek Valley, and kind of about a third of a block that is shared with Fillmore County to the west. That's called Yucatan. Next slide, please. And if you are curious in learning more about where specifically we are spraying, and you want to look up maybe specific addresses or specific towns, you can check out our website, and all of this information is available for there. Next slide, please. So mating disruption, essentially what mating disruption is. This is an aerial application, so it's sprayed directly from a plane. And generally these planes are flying pretty low, about 50 to 100 feet above the treetops. And we've been able to synthetically engineer the pheromones that female spongy moths use to attract the male moths to them when they're in their mating season, right? So we said before, the females don't move. The only way they can find each other is by emitting these pheromones, and then the males catch the scent, and then they follow that scent straight to them. Now what we do is we essentially, or if we flood an area with the pheromone, we confuse the moths to the point where they can't find each other anymore. If they can't find each other, they can't mate. Does that connection there make sense in terms of what we're trying to do? So the product that we use is called Splat GMO. It is not a genetically modified organism. It's not maybe the best acronym. It just stands for Gypsy Moth Organic. This is an EPA certified organic product. It is non-toxic. It is biodegradable. It's actually made from food grade materials. And the pheromones that we are using is specific to spongy moths. So no other organism, no other moth, no other butterfly, insect whatsoever is using this pheromone to communicate. So when we are spraying this, it literally only affects spongy moth. It physically cannot affect anything else. Next slide, please. Now, when it comes to how we actually go about notifying folks of these treatments, because as you can imagine, people don't like the idea of a plane flying like 50 feet above their home at probably like 5 or 6 in the morning. We do everything we can to make sure that local communities are aware of the actions that we are taking. And this is sort of one of the main reasons as to why I am here today. And one of my asks of this Board of Commissioners here is to help us notify folks within the area so that everyone is well aware of what's going on. Now, we do everything we can to notify folks within these treatment blocks. We have mail out informational postcards to residences. So every parcel, every home within each of our 3 treatment blocks within Houston County is going to get a postcard from us, kind of just giving a basic explanation of what we're talking about here. We also have a series of public meetings where I will give essentially a modified version of the presentation I'm presenting on today, and members of the public can come and attend and ask questions or give feedback or provide comments. We are doing these public meetings kind of in larger groups, so we're doing our public meetings for all of Southeast Minnesota on March 18th at 6 p.m. That's going to be virtual, and the information for that and how to attend should be on our website quite shortly. We also do press releases, reach out to local media, and we have an email and text notification system where you can get a text pretty much like right in the morning, the day before, the week before of when we are planning to do our treatments. Now, one of our Mind May asks for you folks today is if you have any websites, social media presence, newsletters, any information that you have, because you know your communities better than I do up in St. Paul. Any ways that you can help us just get the word out there would be really, really helpful for us, because it just helps us make sure everyone's on the same page here. Next slide, please. All of this, this presentation and the work that we do is done within an environmental assessment. So just know that an environmental assessment will be completed to determine if these treatments are appropriate. And of course, all of these treatments right now are proposed. We are not, dead set in any of these at the current moment. Anything can change, but this is what we have planned for now. And any questions or comments from these public meetings will be incorporated into our environmental assessment. Next slide. Thank you all so much. I apologize for going a couple minutes over there, but if you have any questions, I would be happy to answer any. You can also feel free to give me a call or shoot me an email as well. Thank you.
When did you say the application is going to occur?
So for the mating disruption, that's going to be a little bit later in the summer. We don't have like exact set dates. We have time ranges, and a lot of when we're going to be doing our applications is highly dependent on weather conditions, when Spongy Moth decides to wake up. But generally, it should be around June or July. But I can get you like exact dates as we, of course, get closer.
That'd be helpful, but before that August mating period or
Yeah, we want to get it out there before they're actually mating themselves.
sense.
Questions, thoughts, comments, concerns?
No, you covered it pretty good.
Great.
Thank you for your work and your
Thank
efforts.
you.
Thank you so much.
Bet.
Have a good one.
Yep,
Big
thank
deal.
you.
Pictures are devastating.
Yeah. Yep. Okay, next up, Eric Severs of Executive Director of Hiawatha Valley, and John. Good morning.
Morning, Commissioners. Glad to have Eric with us today. For Commissioners who've been around for a while, we like to have Eric come periodically and update the board on the work of Hiawatha Valley Mental Health Center. They have been a partner with Houston County Public Health and Human Services for many years. Provide really critical services in the behavioral health environment. And so we're glad to have him here today to give you guys an update.
Yeah, so thanks, John. So we've been actually a part of Houston County since 1965. So this year is 60 years for us. And it's changed over the years to where initially we were really, everything we did came out of Winona. There's still some of that today, and I'll go through I just have one page, so we don't have a lot of slides to click through. But our mission's been the same over the years. Our goal and hopes are to provide great mental health, substance use services, housing support for people that call Houston County home. And this handout actually, the picture is where we physically exist, but we are all over the county. So when I talk through the different services we provide for people of Houston County, you'll hear like we're all over the county. So the adult, child, and mental health family therapy, substance use counseling, and psychiatry. Most of that is in this building on 221 Kingston, so just around the corner here, where we have therapists Monday through Thursday. We have substance use counselors almost every day of the week. We don't have a psychiatry provider in person, so anything we do for people in this county is either through telehealth or they make the trip with some of our staff to Winona, typically, for a clinic we have there. Adult housing with supports, we have 4 board and lodge settings and a 20 single bedroom apartment building for adults with long-term mental health needs and housing needs. Today, we have at least, I know, one person from Houston County who has lived in one of our housing programs for a number of years there and has done very well there. So they're located in Winona, but they're regional. They're for anybody throughout the region, and we've served people from Houston County for a number of years. Mental health skills. So what that is we have 2.5 people who come into Houston County, meet with adults in their home, in coffee shops, in cafes, meet where people are at, and help adults who might have anxiety, for example. They have a hard time going out. So we go with them and help them do those things they want to do versus making them come into a building or a place. We go to them with our skills services. Similarly, our School Link program, we have therapists embedded in a number of the schools throughout the county, Spring Grove, Houston, La Crescent. Those kids that are on the Houston County line side in Fillmore County, Rushford, Peterson. So we have different levels of staffing where people are physically in the schools throughout the week in Houston County. We're the only provider that has people in all the schools like that throughout the county. And when I talk about we do quite a bit. And when we talk about this as an agency, we don't do more just because we want to do more. We do more because the community needs us to do more. And that's why we do all this. It's not like, oh, look at what we do. It's really just trying to meet the need. One of the things we do offer in our Caledonia clinic that is new within the last year is we are a naloxone access point. So anybody at any point can come into the clinic and grab naloxone medication, Narcan, as well as test strips for fentanyl and xylazine, which is, xylazine is basically medication for animal, it's drugs for animals that some people do take. So we have those harm reduction things in all of our clinics, and so this is just to help save lives as well. The other thing we do offer in Houston County, which has grown over the year recently, is mobile mental health crisis services. So we are the only provider in the county that provides 24/7, every day of the week staffing for mental health crisis. This program has grown as we partnered with Houston County and the counties in the region and the state, where in 2023, typically during a 3-month period, we do about 59 or 60 assessments of mobile crisis. Last year, there was an increase because we were able to add some staffing. It increased to about 87 per quarter last year. So it went up about 30 or so contacts in a 3-month period. This year to date, we've already completed, as an agency, 84. And in Houston County alone, we've provided 11 crisis assessments since January this year. Those might be same individuals multiple times. I don't have that number, but so we are more of a physical presence in Houston County. We have half of a position, 20 hours a week, committed to Houston County to respond to a mobile mental health crisis. We then have people on call, evenings, weekends, holidays, and so we're much better equipped to respond to the need for people in a mental health crisis than we have been before, thanks to John and our partners throughout the region. So everything we do, it really is about partnerships for us. We have good relationships with the schools, with the county, with the Department of Human Services. Everything that we provide in this county, there's someone else involved helping support what we're trying to offer for the community. Well, any questions about what's gotten us to this year?
So do you work with law enforcement too?
Yeah, yes, and
Or like crisis stuff?
yeah, so if, sometimes we will go with law enforcement. More often than not, though, we don't. So it's not necessarily a model where we go with them. But if there's a safety concern for our staff or for the individual, that's what they're there for, is to help with safety concerns. But we do a lot of work through this program without law enforcement because they have their role, and sometimes it's best for us, honestly, to go without. Sometimes it's not a good response for people, and sometimes we do. It just depends, but it's not every time with them. So,
With regard to mobile crisis, it's been a long development period. I think, given the geography that Hiawatha needs to cover and our partners have needed to cover, it's hard to have people on site when a crisis happens. And so for a long time, a lot of it was kind of like phone mobile crisis. You could call and get support from a mental health professional. We've invested pretty heavily through a couple of different state grants to build that capacity, and that's why you're seeing increase in numbers. It's something we will continue to work on. It's something we're committed to. We want to continue to strengthen relationships with our law enforcement and first responder community. Eric and his staff have really done an outstanding job to ramp that up in the last year as we've brought additional grant dollars to the table for it.
yeah, and we're going to see an increase in numbers. We're confident, and it's for you and for the community. No, I don't think it's because there's a new need. I think the need has always been there. We just are better equipped to meet people where they're at when they need help. This I know. We do a number of things that do save lives for people in the community. One is the naloxone access point. The other is this mobile crisis program. I mean, we keep people. The hard thing is measuring this, right? We'll be able to give you good numbers on how many people we're serving. The outcome is hard to really pin down, but I'm confident that if we interact with an individual, we will keep them out of the hospital. We will keep them from ending maybe ending their life. And so it's hard to measure that. So, our housing programs, we have people who live there for many years, are employed. They're contributing in a lot of ways successfully to society, whereas in the past they might have been struggling, and just from a cost standpoint, costing the society more than they do by us helping them be safe in a housing program. So I think it's a question I get a lot is, as you're seeing more, is there more of a need? Maybe. I mean, I think we're doing better at meeting people at a better place with our mobile crisis program, with our services. We've increased programming in almost every county we're in since 2020. And so we have a full-time therapist here in Caledonia, which I don't know if we've ever had. We have a substance use counselor. I think every day of the week we're open, we have a substance use counselor here. And now we've increased staffing with crisis. So this county, we're in 5 counties: Goodhue County, Houston, Fillmore, Wabasha, Winona, and this county is, I think, the second highest number of folks served. So we're staffed pretty well. This year, coming in 2025, I just wanted to share quick that we offer a thing called a peer support network. We've done it for 15 years in Winona. We started last year in Goodhue County, and we just started this year in Wabasha. What that is it's a place for adults to come in, hang out, socialize. A lot of people we see coming into our peer support networks in other counties really don't have anywhere they belong. They don't have friends or relationships. They're not comfortable with your more formal civic groups like Kiwanis, Rotary, Lions Club. And so we're hoping in the next 30 to 60 days here to start providing something like that in Caledonia. And our plan is at our clinic where we have it now to just start trialing it and see how attendance is for that. Thanks to some of the opioid settlement funds, we applied and received a grant through that process to provide naloxone trainings. We're hoping to provide 6 this year throughout Houston County. We have 4 staff who are going through training, I think, this week or next week to train others on how to administer naloxone. One event that's been I haven't been involved in it, but I know there's a great group in La Crescent meeting with one of my staff about bringing Light into Darkness event at the La Crescent Hoka School in April. I have the date and times there. It's really to share information about suicide, and I think one of the challenges with suicide is the stigma, and a lot of people don't want to talk about it, so as a result, people struggle. People who lose loved ones by suicide really struggle after the fact, and there's a lot of research that says people who have known someone to die by suicide are at a heightened risk of dying by suicide themselves. So this is a community conversation that we've done for a number of years in Winona and in Lake City. And then the last thing I had is with our 60th anniversary, we're planning an open house in October. So there'll be more information as we kind of finalize that, but we'll have it at our clinic here in Caledonia, and that's our plans that we know of for sure for this year, so.
We're also working with a community group in Spring Grove, including schools, in hoping to have a similar type of Light into Darkness presentation there later in the year. Those have been really, really successful, and we work to get a lot of press coverage and have, it's normalizing the discussion around mental health and hopefully improving outcomes. Lastly, I'd say that we also, and you'll see it later in your agenda when you approve a contract for Hiawatha, a big part of what we do in that contract is we receive clinical supervision for some of our social work staff. You need to have a certain certification. Our staff, we don't have anybody on staff with that certification. And so again, it speaks to the partnership that we have and have had for many years with Hiawatha.
Any questions for me or?
Just a comment about the bringing light into darkness. That's actually for students, but also for family, parents, information, right? So it's
I
kind
think
of
it's two.
more of a
It's like a
separate
daytime
sessions.
Yeah, I think during the day, the students are gonna watch this My Ascension showing. It's a young female who had a serious attempt on her own life and has lived and now tells her story about how that was for her and how she's recovered from that. And so the students see it during the day, and then at night it's for whoever in the community wants to attend, yeah.
Yeah,
Yeah.
which is a nice bridge, because a lot of times those school programs aren't necessarily shared with the parents.
Yeah.
They have a lot of questions. Thank you.
I think our students and youth today with social media and the bullying that goes on, I think we've seen an uptick in that.
Yeah, I think,
It's a tough one.
everybody, I think, it's interesting comment because the ability to access information very quickly and some bad information predates everybody in this room. I mean, none of us lived through, like when I was a kid, I was just talking to one of my board members about, there isn't, the whole community is gone. Like I'll go outside, my wife and I will sit outside and nobody's like, where is everyone? And so you could be an adult or child or any age and be in your home, interacting all the time with people and never really connected to anybody. So this sense of connection, that is what I see. I go on our peer support networks and that is what we offer these adults. They actually feel connected to somebody and like they belong and they don't feel judged. It's so easy to be really, really cruel to someone without ever being in the same room with them or talking to them.
Exactly. Yep.
And so the misinformation, the ability to communicate with others without ever being with them is just so different now. We're challenged as an agency of, in the current environment. I just sent something out about this, about, what's real and what's not from a financial standpoint with us, with potential changes with the Department of Education, with changes at the state level with funding. And what if any of that is true? What if it does, so we're just working on plans because we get over $1 million in unique funding from different grants that what if they would end? What would we do? So it is, and you get so much information and trying to make sense of it is
Through that and
Yeah.
whether it's accurate or not.
A lot of it is half-baked. you know, there's decisions or things that are, proposals that are put out, but it isn't a final position or a final decision or a final action. But again, I think Eric's right. We have access to information much quicker, which on one hand can be really positive, but it can also really snowball, and so that you're really not getting information that's helpful.
I think the best thing we have as an agency is the partnerships then, with what we're talking about. It's with John and Houston County, with the schools. I was talking to the Jen Hengel from SEMCAC yesterday. We don't work with them, but we just needed to connect on how you do it, you know? Because when I heard about possible federal funding changes, I called her right away. I said, how are you doing with all this? Because I know they get a lot of federal grants. So I think the relationships at every level is what's helped us survive the 60 years, and we'll be here for many years to come, so. But I appreciate, I don't know if any more questions or comments that I could help with today?
Thank you for
Yeah, thank you.
providing the services.
Yeah.
So, it's critical.
Yeah.
Couldn't do without it, honestly. As a, healthcare doesn't necessarily cover a lot of this. People think that, you know, someone can be hospitalized. It's not that easy. So, thank you.
Yeah, thank you. Thanks,
thank you.
thank you. Yep.
All right, moving on. We'll do the review cash investments through December with Polly.
Thank you.
Thank you.
Thanks.
Okay, so the last time that I did present was as of June 30th. So we're gonna go 6 months ahead. These numbers are as of December 31st. As far as the county's investments. So if you wanna start in the upper right-hand corner, we'll look at that pie chart. Kind of gives you an idea of the different maturities, the 1 to 3 years, 4 to 5, 6 and over, and then our liquid money market account. If you look directly to the left of that, the actual numbers are broken down and they're color coded, so they kind of match. And as we look down the list and a little bit on the back, you will see that our actual, those are our CDs and investments, each one separately showing the balance, the rate, and the maturity date, as well as where they're invested at. So pretty self-explanatory. We've got some rates that were locked in at a lower rate there you can see for a time period, but.
Yeah, there's some 1%ers here.
Right, yep. And we've looked into changing those and we've just been told you're better off leaving them mature out and,
Because it'd be a penalty to,
yeah, yeah. So, the good news is, I guess, 2024 was a great year for income. We ended up with little over 507,000 in interest earned. I look back in 2023 and with rates, you know, this is rate, it affected it, but in 2023, there was 337,975 in interest earned. Went back one more year, in 2022, it was 134,000. So we've been doing pretty good with those rates as they,
back when low interest.
yeah, exactly. Yep,
So what were we at, 500 and some now?
yep, 507,606 is what it came to for 2024. So in looking at this, the grand total, which is in a light green bar in the upper left-hand corner of investments, when we compare that number, which is the 10,691,637, 6 months ago in June, we're up $500,000 from June just in investments. So that was good news, moving in the right direction. The second page, if you'd like to look at, which is labeled just our cash book total, and it kind of gives you a breakdown quarterly of the last 5 years. Shows you the number at the bottom there as of 12/31, the 14,841,571. That's the investments on the first sheet plus the different checking accounts that total the 14 million. So kind of gives you an idea both ways there of where we're at. Does anybody have any questions?
This includes Merchants Bank plus Ison's Bank.
And our brokers, yep,
Multi-banks, Raymond James and all them.
yep, Wells Fargo.
So do we have a, like, since switching to merchants, do we have a number that interest that we've gotten through our workings with merchants since we switched to them or not?
I don't know if it's broken out per se, it's included, but
Yeah, it's all included. I was just curious.
We code everything to one revenue account, but we can give you
Okay. I just got one question, I just, cause I don't know. From 2020, we had 19 million. We're down to 14 million. I know in 2023 was 13 million. What does that mean? Are we burning through cash or it's just of budgeting or?
Are you asking about the change in the?
Yeah.
why it varies?
Yeah, the cash book total is what I was referring to.
that just Carol is,
We're down to 11 million in 22.
analysis.
Well, yeah, I see that, like,
And part of it has to do with,
timing.
well, yeah, that too, and when we spent all of the, CARES money,
Oh, yeah, CARES and ARPA.
right? Well, ARPA
Or
would
that-
probably be between 2022 and 2023. There's, fluctuation there.
Okay,
That would be the ARPA money, but 2020 would be the CARES money.
okay. Oh, that's why it was extremely,
Because
yeah.
that was, didn't we get like 5 million
Yeah,
CARES money?
4 million maybe or something,
At
yeah.
3.2 at one shot, didn't we?
Yeah, it was, yeah. Okay, that explains it.
and otherwise, we'll be back in 6 months again to kind of compare the two sets of numbers again and kind of keep tracking it that way.
All right.
Thank you.
Okay, anything else? Okay, thank you.
All right, labor negotiations, we'll put that towards the end, like we have been. Moving on to the consent agenda, there's, 4 items on the consent agenda.
I just got one question. The registered nurse, is that the money that we're getting the federal grants from? Correct. Have we received any of that yet or not?
Gotta spend it together.
You got a what?
Gotta submit invoices.
To get it.
So if we submit invoices, we gotta pay the bill until they pay us back, correct? So what happens if we pay the bill and all of a sudden the federal funding's cut? Then what?
Well, this is a state deal, isn't it?
Well, it's federal, I thought.
The money that's,
You could come forward, that'd be better.
The money that funds this is state funding. It may have a federal source. So the primary purpose or source of funding is foundational public health responsibilities and response sustainability grant, which were new grants that came to us in this past year. So how federal funding will impact that is hard to guess at this point. If there are impacts, we will have to adjust and make decisions, but it's really hard to speculate.
Yeah, this was done through the state legislature.
Correct.
In 2023, right?
Correct. Yeah, it's in state statute,
Yep.
as are the responsibilities. Now, maybe the money has a federal source that will have an impact on that, but I have not heard that. And, I mean, right now, we're kind of in an environment where there's a lot of things up in the air. And so, but the funding as well as the responsibilities for those two grant areas are in statute, state statute.
Well, this person would be hired as in a probationary period, correct?
Yeah, all our staff are hired on a
So if
probationary
something
period.
happens within a year,
I'm not sure if the nurses are a year or 6 months.
be it 6 months, I don't know.
1 year?
year.
Yeah,
So we would know, okay, we're not getting this funding or something. We could, possibly say
yeah. When we talked about this was a question that came up, and I've been around and done this long enough to see funding increases and funding decreases. And sometimes you have to make adjustments. The reality is there's up and down resources every year. And we make adjustments in the budget to be able to sustain the best possible services for Houston County. What's being talked about or thrown around out there right now is a little more dramatic, but what will come to pass is really hard to predict. What I will say is, as we have in the past, we'll respond to that. And have recommendation for you and keep you abreast of what's going on.
Okay.
Does that answer your question?
Yep.
Okay.
So for action item or consent item number 1, the effective date is blank. March 2nd.
March 3rd.
March 3rd. Any other questions on the consent agenda?
I'll make a motion to approve it.
Motion's been made. Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye. Aye. Opposed, same sign. All right, moving on to action item number 1, consider hiring Daniel Coogan as a full-time assistant county attorney, D62, step 2. And this used to be a former employee.
Correct. Mr. Coogan left the sheriff's office back in 2021 after being here for 16 years. And he is being rehired in the county attorney's office, hopefully.
Went on to get his law degree and
Correct. Along with requesting that he be rehired, we would also like to reinstate his vacation accrual to the level it was at when he left.
What was that when he left?
So he would have been at the 16 to 20-year rate. Our vacation accruals go in increments by the number of years that you've been employed. And also, we'd like to reinstate his sick leave balance that was remaining after his payout, his 50% or 55% payout.
because he had some remaining over that. Is that what you're getting at?
Correct. What was left in the bank, we would like to reinstate that so he has it available for use. It would just, the thing is then he wouldn't, if he were to leave employment again, he wouldn't be allowed to.
He would be allowed to get that paid out.
Correct.
Just for use when he's in that.
For when he's employed. Yep.
What's the precedence for this? Have we done this before?
Yes, we have.
Need a motion on that, don't we?
Then I'd motion to approve that.
I'll second that.
Motion been made and seconded. Any further discussion? I think he's gonna be a great asset to the county, being a former police officer.
Yep.
Yeah.
He knows what those guys do, and I think
Maybe we'll get somebody in jail.
he's a smart guy, so.
Yep, I think we're lucky that he wants to return to
back.
Houston County,
Yep,
yes.
wants to come back to the county and work here and, yep. All right, all those in favor signify by saying aye.
Aye.
Opposed, same sign.
All right. Do we have
Love your
a,
enthusiasm.
do we have a limit on that? Do you know, Ann, as far as, I mean, if somebody worked here 20 years
Yeah.
ago, is that pot still available for them? Probably hasn't happened.
I don't believe that's ever happened where we've
That
had
would be
that.
crazy.
Yeah, yeah,
I mean, for someone to come back, that's not usually, but this was within 5 years also.
correct. Yep, he left in the summer of 2021.
He's smart.
Yeah, it's really not that long ago, really.
No,
Think about
it's
it.
within 5 years.
Oh, yeah.
That's why I was asking. It makes a difference if it was a long time ago. Yeah.
What's that?
He earned his law degree in that amount of time.
Yeah, I know, so, yeah. All right, good enough. Action item number 2, consider action to dissolve the water planning committee. Amelia.
This was just supposed to be a quick item. Commissioner Johnson mentioned when you guys were selecting committees earlier this year that this committee would be dissolving, and we just needed to kind of figure out the process for that. And there was water planning, or there was a water plan in place at one point in time, but that's been replaced now with the One Watershed, One Plan programs. And so this committee has not had as much demand lately. And when we were looking at how we go about dissolving it, we were told we don't need a resolution, but then the next step was to just reverse whatever process, put it in place. We don't really have solid evidence on how that did take place, but being you guys approved committee members, we're assuming that there was at one point a board action to put the committee together. So the committee did vote earlier this month to actually dissolve, and so we're just looking for a motion from you guys to put in the record that you're in agreement with that.
Yeah, I served on this committee here too, so, and a lot of our discussion, is along the same lines that we do at River One Watershed Plan, so it was kind of duplication committees, so. Plus, there were some funding changes too. I know, Carol, you could probably explain this better than I can, but can you do that, please?
Water plan.
Yeah. A couple years ago, it changed so that we don't actually have to match any of those Bowser grants anymore.
Right.
And so then without that levy money, that's what funded, or that program pretty much just voted on push-up pond projects. And the perk of using our county levy dollars to do that versus state money was that we didn't have to meet some of the state grant requirements, which make them a little bit more expensive. And so when we didn't have to match that, we took away that levy money, then it really cut back on what that committee needed to review.
Right. Yep. So,
Accurate.
Was there a board like committee or was there?
Yeah, it was a few department heads, engineering, ours, public health sat in on it, commissioner, we had 3 public
Yep.
positions, soil and water, FSA, DNR.
yep.
Think in its prime, it was a pretty
Back in the
well-attended
day when it
meeting.
was started, I think Irvin Barth started this. And it had a purpose more, it was the only thing happening, so. But now, since the new creation of the One Watershed Plan, its purpose has gone away. The only thing is the push-up pond. There's still gonna be funds for that. It just is gonna have to go qualify under state, and I know Dan was having trouble getting people to do that, and he was, this constant battle trying to get people to get those put in, and he did get some stuff done though, but, there'll be other ways to do that, so.
I'll make a motion then to dissolve the water planning committee.
Is there a second to that?
Second.
Any further discussion?
They did vote on it, right?
Yes.
There's no further discussion. All those in favor signify by saying aye.
Aye.
Opposed, same sign. All right, thank you.
Thank you.
Number 3, consider approving 2025 Hiawatha Valley Mental Health Contract and rates for adult and children's mental health services. John?
You're gonna get sick of me today.
Ever.
Thank you. These are typically contracts I'll put on consent, but with new commissioners, I thought I'd just run them by and do a quick update on them. Obviously, we just heard from Eric and Hiawatha. We have an annual contract with them that sets rates. And depending on what needs we have, we'll pay those rates. As I mentioned during Eric's presentation, a big part of our contract with them is required clinical supervision for some of our staff. Also, with additional grant dollars for adult mental health and also crisis response, we have added additional services through Hiawatha in those areas. The peer support and also support for the mobile crisis.
Has the rates gone up?
They go up slightly each year. I don't know exactly. I'd have to go back and do a little bit of research. They didn't go up dramatically. I know sometimes, some years they haven't gone up. But
Okay.
yeah, I apologize, I don't have that right at hand.
This is the previous contract, right, that you have in the minutes?
Well, this is the one for 2025, and we do it on an annual basis. And usually we have it in front of you before this, and I don't know, we just kind of got it hung up in some back and forth with signatures between us and Hiawatha.
Oh, okay, I see that.
So it
We've
would,
done this in the past.
yeah,
Yep,
Yeah.
we
Yeah.
do it every year.
I think
I'll make
it's
a motion then to accept the contract.
Motion's been made. Is there a second?
second.
Any further discussion?
Definitely a necessary
Yep.
service, so I have to do it. They've done a good job.
If not, all those in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. All right. Stick around. Consider approving Southeast HMI agreement. What is that?
Southeast Adult Mental Health Initiative.
There you go.
So this is also something that has been around for a while. It was previously known as CREST. I don't know if some of you remember the CREST agreements. I've been on that governing board or whatever for since I've been here as directors across the region that AMHI covers do. None of us really knew what CREST stood for. And so the big changes in this agreement, they're not really substantive other than changing the name to be more reflective of something that would be more intuitively known what it is. So it is the Southeast Adult Mental Health Initiative. It primarily is a group of counties in southeast Minnesota that come together to allocate resources that come from the state for adult mental health initiatives. So in this past year, we've seen a significant increase in that funding, and it's allowed us to allocate some of the things that Eric was talking about, expansion of mobile crisis, peer support, outreach and awareness, those types of things that are all allowable costs. It also supports our local case management for allowable case management services. So we're able to offset some of our local public health and human services costs with AMHI. Again, this is something that's been around for a long time. It was previously called CREST, and the change to the agreement is primarily just that name change.
It's a 2-year contract.
Correct.
We've done this, I remember 2 years ago, I think.
Correct.
I'll make a motion to approve the contract.
Motion's been made
Second.
and seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right. Number 5, consider approving Southeast HMHI bylaws.
So this is a set of bylaws that regulate how we do our work in that regional collaborative. Again, a name change was a substantive change to that agreement. Also, we added executive committees, so as the work of AMHI has grown over time, we've always had like a rotating chair that rotates alphabetically through the different counties. Now we've established an executive committee, which would be the vice chair, the chair, and an at-large member for both the directors group as well as our regional management team, which is representative of typically our supervisors in human services in the different counties, as well as providers and individuals with lived experience. So created those, not that they are a higher level of the decision-making body, but just able to kind of discuss and tee up issues that are more actionable when we come together as a decision-making body.
So there wasn't many major changes in the bylaws, or?
No, just the creation of those 2 executive committees
Okay,
and the name change.
yep.
I'll make a motion to approve the bylaws.
Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right, number 6, consider approving 2025 SEMCAC contract for transportation services. John.
So SEMCAC contract is also something that we do on an annual basis. This is coordination of non-emergency medical transportation and volunteer driver program. It's something we've done for many years. Critical for us to be able to get people to where they need to go for medical appointments and the like.
That's pretty crucial. I'll make a motion to approve that contract.
Motion's been made. Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right.
We'll probably be seeing another SEMCAC contract shortly, as we've been doing some housing work with them, supportive housing, and that kind of thing.
Okay.
Support services, not so much building of houses, but working with homeless prevention.
All right. Good enough. Thank you.
All right, thank you.
Is that new, John?
That is, we
that be
received out of the blue money from the State Department of Revenue for, some of it is for housing and some of it is for, the homeless prevention. And so we contract with SEMCAC to do the homeless prevention stuff, and we're working to come up with some plans for the, housing.
This also stemmed
Working
from,
with Allison and a group, kind of along the same lines as what we did with our child care core team. We're developing a housing core team, and we're gonna set the world on fire.
Good. Sounds great.
all right.
All right, thank you.
Number 7, consider accepting the resignation of Dana Burdness from the Economic Development Authority Board. And thank her for many years of service at the Houston County EDA Board. Dana's been a good member of the EDA Board, and she needs to get off right now, and so.
Possible
moved.
return?
Yeah, possibly a return, yep. Greg, that was a motion to accept?
Yeah.
Okay, is there a second to that?
I'll second it with, again, thanking her for her years of service.
Okay,
Me too.
any further discussion? If not, all those in favor signify by saying aye. Aye. Opposed, same sign. So number 8, consider appointing Sandra Solom to the EDA Board effective 2/18/2025 for a 3-year term. That will replace Dana.
So moved.
Is there a second to that?
I'll second.
There's three.
This was a past mayor. She was a
Three
past mayor in
seconds.
Spring Grove,
Seconds on
correct?
that one.
Choose who?
Correct.
She was a past mayor, yep.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay. Number 9, discuss, revise, approve the 2025 committee list with the possible changes to the per diem schedule. Carol?
Right, I didn't print lists again. I just figured we used enough paper in printing those lists for you already.
It's a book, it's a
We'll
book.
do that. I need to know what your thoughts are on the per diem schedule. Right now, it's kind of listed on each committee, what the per diem is going to be for the commissioners. You've talked about having something different. Just a note that per diem means per day.
You're right. I researched that.
Per
Not
diem.
sure how they're doing that over there. So I
Yeah.
talked to Commissioner Mueller, and I don't remember the guy to the left of me from Goodhue. We were talking about it. It doesn't matter if they have a committee meeting on a regular scheduled meeting or not, prior to or after during that day.
So like our land use meetings and
It's a per diem.
finance. It's a
And
per-
they- and that's how they're doing it, is if you go to a committee meeting, it's a per diem. Now, our per diem schedule,
We consider
We're in
actually like your
line.
land use and those pre-committee meetings to be part of your regular pay. If you go to another meeting, that
Separate.
has a per diem assigned, like the
literally
local
what they're
board or
saying, you're
the
still there.
CSB or, no,
Committee meeting is a committee meeting.
if you go like to the Fillmore County meeting, then you get a per diem. We just haven't done it for the morning pre-board meetings.
Right.
Okay, because I asked
They do everyone.
a few counties about this too and how they do it. And since you brought it up last time, and if it's a different type of meeting, it's per diem, one per day for that type of meeting. So, because what gets confusing is we could have 5 meetings on a Tuesday, and, if those meetings were held on a Wednesday or Thursday, we would have a per diem separate for those. But what you were questioning was the standing committee meetings too.
You're still attending.
Yeah, it's still
I'm just going off what they're, listening to what they had to say.
and that's,
They have a committee, doesn't matter if it's before or after their regular scheduled
It's-
meeting.
right, so finance
They get a-
committee is 1 per diem per day. So if you have it on a Tuesday, it's not included with the
Correct.
county board meeting. That's what a few others do. So, it just,
Yeah.
if you
I
have
mean,
5
yeah,
meetings for
that's
finance,
our
then it's just 1 per
philosophy.
diem. Yep.
Philosophy prior to that was that it was kind of an extension
You guys
of
that get
your
up at 6:30?
commissioners' duties, and then you would report on those committees, but
No, we don't.
however you want to change it, I just
Sure.
need to put it in there. I also need to note that it doesn't take effect until January 1st of the next year.
Otherwise, it's retroactive. That would be a lot. if It's retroactive.
According to the statute, right?
Say that one more time.
It doesn't take effect until January 1st of the next year.
I didn't read that far down into the statute. I was more concerned about how they're getting away with
I-
per diem, per meeting, per.
So
throughout
this
their
is
day.
something that we should have addressed before the end of the year, last year?
Correct.
For 2025.
Okay.
I'll verify that with AMC, just to be sure. And then we'll get that first, the first section where it lists the per diems or, that language, we'll make sure we get that.
Yeah. Yeah, per diem is just
You gotta be
per,
here.
per day, but it was, it looked like it was being perceived as all
it's
these type of
Across the
meetings
board.
count as one per diem.
We don't get overpaid for this.
In other words, if you're meeting here on Tuesday, you only get paid for 1 meeting. So, but what we were talking about
Well, you
was
don't get a
depending
per
on what-
diem for your county board meeting.
Right.
That's part of your pay to be
Right,
base pay.
yeah. So the standing meetings were considered part of that though, is what we're
That's
talking
right,
about.
yeah,
Still a
and that was,
committee.
this has been a policy that's been put in place, years and years ago. I mean, this is the way it
As
was.
long as I've been here.
Yeah, so,
Sometimes
and it's
been
something that
interpretation.
can be changed by the board, so,
Do a little more research and then we'll go back at it.
But in terms of the listings of the committees that you were involved in, do they appear to be correct?
I believe so.
I think we had,
That's your option for
we
the
had the
land use if you want.
Winlac? Was it the Winlac where it was swapped around and now it's put back?
Yeah, you put two together, which was good,
Yes.
so that looked good.
Yeah, I think we've discussed it. It's also helpful, I know, because Bob and I have discussed too, sharing like minutes or the meeting updates, because if you're an alternate, then, if you have to go to the next meeting, you know what's going on.
Right.
So that's just
Yep.
nice between ourselves to share that.
And like the jail operations review committee, is that the one where you guys are gonna try to meet quarterly with the sheriffs, the law enforcement?
Combine it.
Well, that was the CJC and the CJCC.
Yes.
The CJs are all together now.
Yeah.
Okay, that's the one that
And
you're
it's
gonna,
actually just CJC. It's the
It's just one.
County Justice Center. It's not a unless the C at the end meant committee.
Committee. It's,
Not sure, but
it's all good.
we're combining them.
With the
there was a habit of calling it
CJCC.
criminal justice.
Oh,
and-
yeah. At first it was being referred to as the Criminal
Criminal
Justice
Justice Center
Center, and
and,
it's not.
County,
It's just the County Justice Center.
yeah.
Actually, Doug Ailey had
Can't
to
say
go
criminal.
out and look at what it said on the side of the building, because he just didn't believe us.
Oh,
Justice Center.
wow, okay.
So those are the two that are being combined.
Yep.
And that's, you'll be your quarterly meeting with the sheriff and
No, that's a different,
whole
that's a whole different.
bunch of-
whole different deal. So then what's the one that we've talked about wanting to,
The jail one is the one.
okay,
The jail operations review,
all right. That's
yes,
the one you're gonna be, kind
Yes.
of turn into a
quarterly.
quarterly meeting so you can discuss what's
As far
going
as
on.
we're concerned, no, I don't know what they're, on their side of it.
Yeah,
That's what we discussed at the,
Yep.
meeting when we went through these, was making that quarterly.
yep.
It'd be nice if we could get that updated into that meet quarterly in this package.
Quarterly.
So it don't
Okay.
get forgotten.
Right.
And
Yep.
then, I'll get together with you, or me and Kurt will get together with you on setting the, we're gonna do it, January, April, whatever it'll
Yeah.
be to get it
Okay,
finalized, so.
sounds good.
And one other thing, land use plan, you meet twice a month?
No, they bumped it to that.
Did they bump it twice? I mean, do you need to meet twice? You're on it, Bob. What do you think?
It was asked to meet twice because we run out of time and can't get through all of it. I think that can be done as we could go back to once if we feel that we can get by with it, or, if there seems to be a lot going on, we could have two. Kind of just,
Seems to me, to answer your question, like there's a lot of it that could go to the department head. It gets brought up there. I think shorten the time if it's, not really land use, some of it really should be brought up at department head meeting.
well, try to limit
Just
the.
can overlap.
Limit the discussion to where, if it turns into almost like a personnel committee meeting, yeah, I get that. So we'll just play that one by ear. How's that?
I mean, it says second and fourth, right? In there. It could very well be that the commissioners attend the second meeting and the usual group has the fourth meeting, and, it just depends on what you feel you're needing.
Like last week, I wasn't there. I wasn't here.
And neither was
And
he.
you were sick, so I
And
don't know.
they had a meeting.
Did you guys have a meeting, Mary? I don't.
They did,
Okay.
yeah, so,
Met without us. That's probably got a lot more done. Who knows?
oh, did that come out? No, I'm just.
Well, what Monday is the department? That's the fourth Monday of the month, right? Department head?
Put them on.
Coming up.
Well, ask the boss.
What was that, Greg?
I said, department heads, that's the fourth Monday, correct?
Yep.
Correct.
So, and then you have a fourth one of your land use on that same week? Is that true? You have a second and a fourth?
And then that's what this says.
Second for the land use one.
But the department head meeting is on Monday.
Yeah.
Yep.
These are on Tuesday before the commissioner meeting.
Right.
So I mean, if land use had something they had to, they could bring it to the department head on Monday. You know,
Okay. Well, I guess we won't really have to have a, you want to approve the committee list?
With these changes, because you've combined some and eliminated.
I thought we already did this.
You didn't actually officially approve.
I thought we made a motion to approve the committee list. We went through it in January.
But the,
I think you did approve it once
Yep.
at the following meeting after we originally discussed it, but we
Okay.
can approve it again.
with those, yeah, because the meetings were combined. I have these notes.
Yep.
It said they were combined then, right? That,
Correct.
and we've had per diem concerns since, so.
That's the deal.
And that
The
won't,
per
that
diem-
won't change until
Yeah.
later. We'll
have
come
some
up with the
time to-
wording for that, so, okay.
We basically have approved the committee list already. The per diem thing is still in question, and that's something we need to discuss for next year if we can't do it this year.
You think that's by statute, is that what I heard?
What's that?
That's by statute, is that what you said?
because you set it every year for the next year, right? Like pay.
I know we made a motion to approve
just
the
do it
committee list.
Okay.
You wanna double it up? I don't care.
So
Double approve.
the board approval must be received in order for a commissioner to receive a per diem for attending meetings not listed as a committee assignment. I'll research that.
That's why we need, when we went through the list, the first meeting of the month, we approved it so we can,
So you could attend your meetings.
so we
that
can
you were
attend our
assigned.
meetings and get paid per diem if it qualifies.
Per diem
under
just
the
came up though. You
payments.
just mentioned. that.
Right.
And it was already approved in December for 2025.
No, January, the first meeting of the month.
Oh, you approved per diems then? Okay.
Or I don't know about the per diems. I assume that's.
Well, it's part of the list.
It's part of the list, so it'd
Part
be
of
all
it.
the same time.
Okay.
Yep.
So I think that, yeah, salary and per diems were approved.
That was,
So maybe it should actually be a separate, where where the salaries are approved that have to be done prior to the first of the year.
Right.
The per diem should actually be
you're
approved.
correct, Cindy. That part of it was done at the last meeting of the month in December, our salaries and per diem.
No, your per diems weren't.
They weren't included in
Those are-
that?
No, they're,
All right,
because they've always been included on the list.
okay.
So I
So-
think that's what the question is with the statute.
So actually, January, when the committee list was approved of 2024, that's when your 2025 per
Because
diems
it says,
were
it's on that list, yeah.
So basically, you need to research if the statute allows you to change the per diem mid-year, or if you have to wait until you do the list. So between the statute and talking to
Yeah.
Minnesota Counties Association,
Oh,
I
we
think we
will
should be able to
consult with
figure
the,
it out.
yeah, AMC and county attorney's office, just to make sure that we're doing it right.
So you'll do that, or someone's gonna head that up?
Yeah.
Checking into it.
Moving on then.
On January 7th.
Okay.
Cindy moved and seconded it.
And I can give you the names of the counties that I've contacted that have the per diem at, with those standing committees being a separate per diem. I think everybody they don't all have the same committees. Every
Yeah,
county-
they're all
Different per
different.
diems too.
Right.
Some counties have higher per diems than others.
Oh,
I
yeah.
think it should be based off your county size. I mean,
Variable.
Boston or
It's just
Muller
something that
County
needs
is
to
a
be
bigger
reviewed
county
and
than
looked
us,
at.
you know.
So can we bring it back to the next meeting or?
Could be something brought back up for discussion.
Bring it back next month, or next meeting, if you can get it done by then.
Sure can.
That's next month.
Because the first meeting in January, that's when we made the motion to accept our per diems and everything after that first meeting, because everybody got their committees. So, I mean, now it's just, if we're gonna rechange this, that's what we gotta work on.
We'll do some research and make sure that we're
Yep, doing it right.
at that end.
Right? That's good.
All right. Moving on.
So
Go ahead.
I guess the next item, on the list for discussion, and I guess possible action, it was just thrown in there, is we've received the resignation retirement notice of our county recorder, effective April 1st. It is an opportunity that the county would have to make this position appointed rather than elected. I gave you the statute that addresses this and the requirements to make it appointed. You have to publish a copy of the proposed resolution in a newspaper for 2 weeks. You have to hold a public comment session at a county board meeting. And then approve the resolution to make it an appointed position. So the board has the option of appointing someone to complete the term, Mary's term, which ends
2026.
26, or start this procedure to make it appointed office rather than elected.
You still need someone in that place, right?
Yes.
Interim?
Well,
Could we still appoint to fill out the term and then still consider making this a appointed position?
you could.
So if this becomes an appointed position, would they be considered confidential, non-representative?
It would be a MAPE employee.
Has this been discussed before, as far as
Yeah.
going to an appointed position? What's your discussion on that?
Why does it have to be MAPE, Carol? Wouldn't that be
Because it would be a supervisor,
department head?
department head supervisor, which Minnesota Association of Employees includes,
But it's gonna be an appointed position, just like the veteran services officer, the highway engineer,
right? And they're members of MAPE.
right?
Is there an advantage or disadvantage to that?
The county has more authority over an appointed
Versus
position as
elected.
opposed to elected, because really the county board doesn't have authority over it.
How many other counties in our area or within the Region 10 area have appointed versus elected? How many in our area, and I use Region 10 as southeast Minnesota,
I'll find out for sure.
I'm just wondering how many are appointed versus how many are elected? And if this is a trend one way or the other.
It's a trend to go to the appointed position from what I've been seeing over the years. And I don't have a problem with that. The only issue I have by saying, is because of the language in the MAPE contract. That one paragraph, it says, all appointed positions shall be reappointed.
Don't look at that.
And it takes away our authority,
So it says shall, not may?
shall, unless we go through all the processes of unions to not reappoint someone. Because we got hooked on that with the assessor's position. But we actually came out on top on that at the end because of the DOR statute. Saying, because we already got their approval to accept that assessor position, the new one. But we had a grievance on that with the union. And it was because of that one clause in the contract. I guess I could
And
bring
I
that
don't
up.
know that this appointed position would have that clause.
If
Well,
it's,
if it's
if
under
it's
that
MAPE,
MAPE
if it's under the
contract.
MAPE contract, it's in there.
But, I mean, I think there's a difference because they're appointed for a specific time based on statute
Every 4 years.
every 4 years. this would not be like that. This is
Well,
a,
that's something we need to find out.
yeah, this is a position, an at-will position.
Yeah, because this,
So we'll,
that paragraph was added in 2012, I believe. And it changed, it took away our power as a board to, you know, because we're taking away, if we're gonna make this an appointed position, we're taking it away from the public to decide by their vote who gets to be recorder or deputy auditor, treasurer, whatever. It's reverting to the board to make that decision, but if it's in the union contract that it's,
Once they're in there,
it takes an act of Congress to, if they're not performing their duties, I'm not saying it can't be done, it can be, it's just, it's
well, it's no
extra,
different than any
extra
other,
hoops to go through.
any other position in MAPE. If they're not doing their duty, you're going to have to go through those, you know.
I think we gotta do some more research on
Yeah.
getting
I'm
this-
wondering if other counties might not have the same
Let's find out.
bind, you know, that they, once that person is in there, they haven't been appointed, or they've been reappointed.
Well,
because
you
they
know,
have
that's
to.
why I was asking if it could be a confidential employee,
Yeah,
a non-represented employee. That would be-
Confidential employee, the definition was changed in 2014, actually. A confidential employee is only an employee that actively participates in labor negotiations.
well, that's,
So we have people who
Yeah.
have been considered confidential that aren't. Unions are looking at,
So have we changed our language for that, or have we just been not doing it?
there'll have to be a petition through the Bureau of Mediation Services to have those employees added to a union.
Okay.
And that's happening.
so in the meantime, do we need to move forward with an interim appointment or talking about that?
Didn't do that right yet. no.
Okay. Well, not doing it, but I mean, is
We'll do
that,
some research
yeah,
to see what it means.
Yeah, cause Mary's not gonna be till April, right?
April 1st.
Yeah, let's research this a little bit. We'll talk to the unions and see what they got to say, and then we can
Well,
come
no,
back.
or the MAPE,
we don't need to talk to the unions.
find them.
Board has to research
You have to
what
make
is
a
in the best
decision.
interest of the county.
You'll bring us back some options.
But I was in contact with Ryan from AMC. Ryan
Ryan Erdman?
Bergman, yes.
Okay,
And it's something that the board has to approve by a supermajority.
Yep, 4/5 vote. To change it to appointed.
Right. After
Public hearings.
the publication in the newspaper and a public comment. It's not necessarily a public hearing, public comment period.
it would be nice to have some input on that, I mean, public or internal staff, as far as,
Oh, yeah.
you know, those that are already in that office or in that position, to,
I've had discussions with,
yeah, to hear that. Good.
All right.
yeah, so that's what we have on that. And that's
Okay,
pretty much the sessions that I have right now.
number 11, consider reviewing and improving payments. Any questions on those?
I looked through them and they all appeared to be in order. I make a motion to approve the payments.
Motion's made, is there a second?
So move.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Bye.
Same sign. Administrator updates, Carol.
And that's pretty much encompasses, lots that we're doing, researching, working on day-to-day and stuff and
Okay. Board updates, for me, I had a extension meeting here last Thursday. Just just went through met with the new people appointed to the plan commission. They're a good addition to the extension committee, I mean. They're good people to be on there, and discussed what they're gonna do in the future, so. Just general discussion, basically. The new introductions of the new appointees. I think it was Pete Privet, Pam Hendel, Joni Schmidt, I believe, was the third one. We're fully staffed, or the committee's full, so. Other than that, I don't have anything else. I was gone last week, so. Had an EDA meeting. Where we got to see Sandra, their new appointee, and discussed what's coming up in business. I don't know if Cindy wanted to bring some more up on that.
How did the event in March, do you want to highlight that? There's a career event in March, first week of March that EDA talked about.
Sure. So, March 5th, we have our annual Bluff Country Collaborative Career Fair and Hiring event. Students will be attending, but it's also open to the public. So it features businesses from Houston and Fillmore County for full, part-time, and seasonal work. So you're welcome to stop by. It's from 9 a.m. to noon. And then the other highlight from the EDA meeting was that we set our 2025 EDA revolving loan interest rate at 3.5%. So if businesses are in need of a loan, have them contact me.
And that event is in La Crescent, right?
Yes, it's at the La Crescent Area Event Center. Thank you.
Very good. Anything else? As long as you.
Oh, you want me to continue?
Yep.
Okay, let's see. I've gotten acquainted with WinLAC and shared information with Bob. The policy committee met last week and talked about one of the primary concerns for this area is the Pine Creek project that they have. They have a $500,000, $500,000 grant fund for helping create a better environment in that area in Pine Creek, in La Crescent Township area. They're going to be able to remove a lot of the dead trees and make sure that flow is better through Pine Creek in the waterway there. So there'll be more information coming out to residents within that area shortly. But WinLAC is sponsoring part of that grant money. And so they are sending out a letter to area residents and also from La Crescent City. It's very close to the golf course in that area. So that's actually a good project that will be coming out in this year. Let's see what else. We had several Minnesota Department of Health meetings in the last couple of weeks, and I would also combine that with community services. We talked about some of the concerns with federal funding. That seems to be the talk on the agenda for a lot of our meetings that have some federal funding needs, and whether or not those will continue to be filtered through the state legislative areas are still kind of up in the air, and AMC does have a legislative conference next week. So, it's kind of day-to-day updates. I don't think anybody can predict anything at this point as far as federal funding cuts or a lot of positions that are disappearing off of those registers. That means that there could be some differences in delays in payments or funding, so we're watching that closely from all aspects of the state to make sure that does not affect our services here. Let's see, what else did I have? Seems like I had something else to share. One thing that I'd like to share, can I make a comment along with my committee updates? is, and I've been talking to the department heads at orientation meetings and have a list of questions that they are answering, just so I can get to know them better and figure out, what's going on, and also that they can share information with the board. And something that I would like to propose that we do from, if it's all right with the board members, is that we have occasionally when it comes up, more of an employee recognition. It's not an award, not a big deal, but it's kind of a moment of hearing what's happening in a certain department, because there's a lot of good work out there that the department heads would like to share with us, and then we can just mention it at a board meeting. Just that this was going on, and this is a good benefit with all these negative, the things that we have to do and face, a lot of negative decisions and things that could be coming about. We just need to realize that there's a lot of good work going on and recognize that. I thought it was great to hear that. So I just like to make it more of doesn't even have to be a standing agenda item. It's just whenever it comes up, and it's not a big deal. It's
Special
not-
mention, yeah.
No special parking spots or anything like that. We don't have to make it a big deal, but just to recognize that and hear about it.
No, that'd be good. Anything else?
No.
Commissioner Zender, you have anything?
Spent all day in Rochester here a couple weeks ago on a Monday with it was a joint combination between the RAC and interesting as well, I'll say.
With what now?
So basically it's E911
Okay,
for
yep.
all the area plus the RAC.
Yep.
That's the sheriff's side of everything.
Yep.
Mark Olson was there, the sheriff was there, and then on the other side of the table, on this big huge horseshoe, a whole bunch of commissioners. It's a safety committee. There's a whole combination of a lot of stuff going on over there.
Okay.
So I don't have a lot of public comment somehow how they do some certain things.
Okay.
It was education, let's just put it that
Yep.
way.
Yep. More fire hose stuff.
Oh, it's way beyond fire hose. It's interesting.
Commissioner Schultz.
Oh, I missed the land use meeting. I was ill. You were out of town, but so went on without us. Other than that, that was my only committee meeting on that, other than, we were busy with personnel, and I don't know if we're gonna do an introduction.
Well, I was just thinking that too, that maybe when
we-
we're done here, we could have
Hang on, we'll have a public comment.
Okay, good.
Okay.
So been busy in personnel, so it's all like we're gonna be busy the next month too, so. Other than that, I've got a phone call this morning on the solar
Proposed project coming.
project is a good term, yeah, so there's still talk on that moratorium, so hopefully we have some more updates there.
The phone call, was it an against or a for?
It was an against, so.
Okay.
A lot of things going on.
Yep. Commissioner Mary?
Personnel meeting last Monday, and Carol will be touching on that here shortly. Had a township association meeting. It was a terrible night, snowy, icy. I called the chairman, and he said stay home because he didn't think it was gonna be a very good turnout. Did you make it, Bob?
No, I couldn't get out of the valleys.
It was pretty icy and slippery, so
Okay.
I haven't got any reports back from any of I gotta talk to Larry Ghosted, get some information. Amelia talked at it. I don't know what she talked about, but
Okay.
I don't know, a solar maybe she was talking about. I don't know. I didn't make it, so that's all I got.
Yeah, and I asked you before the meeting too, if you could attend the planning commission meeting, 27th.
That's
Yeah.
Next week?
on the 27th.
Next week, yep.
The public hearing, so do we all gotta come?
Nope, it's just for the planning commission, so.
Okay.
It's not for the county board, it's just for the planning commission.
Well, why is it a public hearing then?
Because they have to have a public hearing too, if they're gonna adopt some different ordinances.
Okay,
And so that's why it goes through the planning commission, then it comes to us in the end.
I was just wondering, because she didn't mention anything about planning commission and it just like a public hearing, so I was just curious.
Yep,
We could sit in the corner if we want.
okay.
Public hearing, you can come, can't you, if you want, on a public hearing?
Well,
Just not discuss.
Yeah, you can't discuss or nothing, it's because we don't want to have a quorum there, I mean.
You can sit and listen though.
Right, as long as you're only observing. you're
Right.
not- And the board isn't making a decision there.
Well, it'll be coming to the board eventually, so.
It's
If
good
you
to
wanna
hear,
it Firsthand, it's a good.
yeah, it's good to hear the input.
Just don't
Get
say
more-
anything.
We can have assigned seats in different corners and.
Zip it.
That was evil.
it's not-
Cindy, you gotta sit in that corner, I'll sit in this corner.
Got it.
So I just wanted to mention too, that I've sent you guys forwarded you that email I got from Goodhue County about the snowmobile trail thing, so that's gonna be an ongoing discussion that's gonna be had by all the counties in the southeast area here, so.
Yeah,
So have the snowmobile trails actually not received money because of this? They haven't received
DNR has
any
withheld
portion
all
of
the
it?
money.
Correct.
They've
That should be
withheld all
coming
of
to
it.
here, and then it's distributed from here, correct?
Yep.
And I was reading the verbiage too. Some of it makes 0 sense. There's no common sense in how they disperse that, because they're liable for the state highway if you're in the ditch. So why are you putting your state highway on us? So I agreed after
That-
reading your verbiage on it and spending a little time researching, and I agreed with you. They're already responsible for their highway anyway. All they're worried about is that little space that our groomer goes across, and they want to put all the liability on us. And that's not right.
So did our local clubs get ordered to take their signs down too?
So that was the next thing.
Are
I
they,
was asked on my regular job if we were going to enforce that. And that's a tough one to enforce. How do you rip your signs out when it's ice?
That's a bad idea. It's a safety concern.
Not only that, but now if we do have snow and some people, 1.5 inches is enough to get their snowmobile out.
Right.
If a stop sign is on the highway and they order us to take them down and they cross that in the middle of the night and get hit, who's liable?
And, well, plus,
I would say the
I don't
state
think the
is.
trails are officially open though, are they?
No, but there was one on 76.
I know, they're always gonna get somebody that's out.
They're out
because-
there.
They're out.
But I haven't seen any official notice of them being open yet, because there's not enough snow. But, no, that's right, there's a liability, I mean, that's when I had the conversation with Commissioner Anderson from Goodhue County, that no way that they could approve that LUP, because we would be liable and MCIT would not cover us if there was a incident. So
If we're held liable for our county roads, that's one thing,
that's one thing,
but we should not be held liable for the state highway.
right, that's not our baby.
It's
Right.
theirs.
And
Do you,
then- and
do you know,
snowmobiles-
Eric, if, the mapping concerns have been helped by, with Brian and, Polly? I know that was kind of a couple of the clubs, they don't even have a computer to
A lot of
do
the
it.
clubs don't have
They don't have
that,
that resource.
they don't have that resource to provide the detailed mapping. I know Brian sent our version of a detailed map to the DNR, and they said that wasn't good enough.
I was just hoping that we continue to follow up and work with them. So.
Yeah, and I mean, if that isn't good enough, I thought that was a pretty darn good map. It had showed all the locations where that was gonna be the case on the two-way nighttime traffic deal, so.
And Goodhue discussed having a contract between the county and the clubs. Is that right?
Well, it's like Commissioner Anderson said, that if, because that's what they were doing, they were just being the fiscal agent. The money passed through and divvying it out to the clubs. They didn't have any say on how the clubs are run, or didn't have know any of their financials or anything, so. And they didn't get an administrative fee, so if we're gonna start to be required to do this as a official act, we're gonna have to have an administrative fee. Then we're gonna have to wanna look at the books. I mean, kinda like we do with the county fair, we get to look at their books to see what they're,
But.
do we wanna get into that?
We really
No.
aren't just their fiscal agent, because there's a contract between the DNR and the county, and they do an annual audit. of the snowmobile trails, right?
Right, they do the audit with the individual clubs.
They come here, don't they? Or they haven't?
Special type
Mhm.
but it's not every year
Mhm. But I think if you looked into it, I mean, that's what our state auditor said, that you're not just a fiscal agent.
So then that
Probably
means,
should do some
on
checking.
our end, we're gonna have to start doing more on this then.
And the snowmobile clubs are concerned. I've had a few calls and
Wouldn't it be like
just
beneficial for us
because
to
they
sit
don't
down
know
with our folks?
what our reaction is. So I think they're looking for some discussion and input at this point from the
Maybe we
board.
should invite all the snowmobile clubs to a workshop.
Yeah,
That'd
because
be a really smart idea.
there's only, a couple clubs that are really into this. And I think the others are waiting to hear what's happening. So that might be a good way to get
Could get some
conversation.
input out of it anyhow.
Yep.
I
Yeah,
don't
that's a
think
good
we should
idea.
make a decision on something until they're involved with it.
Well, it'd be nice to hear their perspective on some of these things. And
100%.
the biggest thing
Those
was
people
taking
elected us
down the
too.
signage, that was the first thing for them.
That was
They
ordered
wanted
by the DNR.
Yeah.
Or the DOT.
DOT.
That was their first concern, and that's
From the
just,
DNR to the DOT.
okay.
I think it
Yeah.
was the opposite.
But I think we need to
DOT said
keep
it to the
moving through the discussion.
Either one
We
way.
have
my
to figure out how the
opinion.
DOT can make decisions like that. I mean, because it's the state, they can do what they want, but I think it's ridiculous.
Well, should we keep moving on?
Yep.
Sorry.
Closing public comment.
Brent. We have here Brent Parker, who was hired as the HR officer.
Hey, nice to meet you.
Nice to meet you.
At the-
Welcome aboard.
Yeah, thank you. Yeah, super excited to, get started and get
Have
to
a
know
seat,
everyone.
have a seat and introduce yourself and your background and
Okay, yeah.
tell us a little bit about yourself.
Yeah, so my name is Brent. I've spent the last 20 years in law enforcement, so I'm stepping away from law enforcement. A couple years ago, I went back to school, started getting my master's degree in public administration.
Okay.
I had my master's degree in public administration and finishing up a second master's degree with business administration with a concentration of human resources. So this has been a very good opportunity, so I'm really excited to get started. I've been in public life for, like I said, my whole career. I wanted to stay in the public sector. I currently live in Decorah, so it's relatively close, and
Okay.
trying to migrate towards this area. So yeah, it's gonna be fantastic. And so I look forward to talking to you all individually and answering any concerns you may have coming with human resources issues coming up, which I see there may be a few. So, so I've been taking notes back there and
Have your
preparing
hands full.
myself. Yeah, so, yeah.
He's been involved with labor negotiations
Yep.
and different aspects of HR.
Yep.
Being an assistant
Yeah.
police chief.
And then, so I also sit on the city council for Decorah as well. So, kind of sit on your side of the table as well and serving my community in that capacity. So
Good, so you kind of understanding where we're coming from.
I completely understand where you're coming
Alright.
from. Yeah, yeah. So, and the struggles that you have, I definitely understand
Yeah.
that as well. So,
Welcome.
yeah. Well, thank you.
Thank you.
Where were you, a police officer?
So I started in West Union. I was the chief of police in West Union, and then we ended up going to Decorah, moving to Decorah, a little bit better quality of life, and I was the assistant chief in Decorah. And at that time, I was kind of starting to figure out what I wanted to do, and I didn't necessarily know if I wanted to continue in law enforcement, and so I kind of came to a head on some of those decisions. My chief went to retire, and I was like, well, this seems like a pretty good time to do that. I wanted to run for city council, so I could not do both. I could not work for the city of Decorah and also run for the city council. So I ended up working for Waukon, running for city council in Decorah, and still live in Decorah, running on the city council. So, and currently working in Waukon, finishing up that.
Okay.
Yeah, so. Here,
Thank you.
Yeah,
Well, welcome aboard.
well, thank you.
Good to
Appreciate it.
have you. And
Thank you for crossing the state line.
Yeah, yeah.
Maybe in the future that might.
It
move
might
up.
not be the state line.
Oh, that's right.
know we will, but I mean-
Did you ask him how he feels about
20
that?
years ago.
Counties?
You know, the bottom.
Oh, yeah, it came up in our interview and I'm like, that's kind of a touchy subject. I didn't really know what the feelings are up here about that.
Do we
so.
want them or
Yeah.
do we
Special
want?
question just for him. He knows.
Yeah, exactly.
That doesn't have much to do with what,
No, I think we're past that.
that's gonna be
didn't
done
mean
by
nothing
higher
bad.
ups than
Just
us.
giving you
That's
shit.
exactly,
And I'm okay with that.
yeah.
So you're starting.
Maybe it's taken
starting
us, the
March
rest of
3rd.
us, like 10 more years longer to
Great.
figure it out.
Excellent.
So,
Thank you
yeah,
so
super
much.
excited and
I'm
when
not
I
saying
start,
a
I'll
word.
probably connect with everybody and have conversations and see what your thoughts and processes are and what you're looking for. So.
Sounds good.
Welcome.
Thank you.
On tablet.
Yeah, I think there may be a list being made. So.
Oh,
All right, good.
Yeah, hey, thank you for your time and the opportunity. Appreciate it.
thanks for stopping by.
So are we closed session?
Yep, that's next,
At
I
that
think.
point?
We have a motion to go into closed session.
So move.
Second.
Second.
All those in favor signify by saying aye.
Aye.
Opposed, same sign. Hey, Allison, at 11:18, Greg made the motion to come out of closed session, I think.
Bob,
Bob
second.
Schultz seconded.
Uh,
Go ahead.
The board met in closed session pursuant to Minnesota statute 13D.03 subdivision 1 to discuss labor negotiations. At this time, the board will entertain a motion to approve a tentative agreement with LELS 415,
Yeah,
Lieutenant.
yep. So we discussed the tentative agreement with Lieutenant, local number 415. Do we have a motion to the tentative agreement?
I'll make a motion to the tentative agreement.
I'll second it.
Any further discussion on that? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay. Any closing public comment? Of course, we already did that, but
More?
any more? Do you have a motion to adjourn?
So move.
Second.
Any further discussion? All those in favor signify by saying aye.
Aye.
I gotta get a